I'm Steve Hutchinson. I'm a peripheral vascular surgeon with Wichita Surgical Specialists. It's hard to say when I decided to become a doctor, but I always like science, and I like math, and I like fixing things. I think that's kind of when I knew that I wanted to be a physician and then a surgeon, because I was always fixing things that were broken. And what I do is essentially fix circulation. My mom was a nurse. My brother's a physician, so I come from a line of physicians, so I was very aware of what I was getting into, and I enjoy thoroughly what I do. When I'm gone on vacation after 4 or 5 days, I'm ready to go back and get to work. I put a lot of time and emphasis into the initial encounter. Occasionally I'm running a little late, but once I'm in the room with the patient, it's all them, and whatever time is necessary, they get. I've found that once you put the effort into the discussion initially and help the patient get that clarity and understand what the problem is and what the options are and which pathway we're going to choose together, then things generally go very smooth after that. So I really am a big believer in the initial encounter, and that's where you build trust, and that's where the patients go from fear and unknown to known and a path forward. I think motivation and compassion is something that you either have or you don't, but I've always had that sense of purpose, and I take my responsibility very seriously. But the basic essence of what I do, patient care, one-on-one interaction, fixing patients with circulatory issues, that hasn't changed, and my enthusiasm and the satisfaction I get out of that has not changed in 29 years. I am a bit of a workaholic, I admit it, and because I like what I do. Nobody forces me to do this. I do it willingly and joyfully. And the Kansas patients are the best in the world. They are appreciative for everything you do, and they can't wait to get back home to the farm or the ranch or back to work. And they're really very common sense people. These are really the best patients you could have in a practice of medicine. I would pick vascular surgery all over again, no question. I made the right choice, and I can't say that I was all that, had great foresight. I was fortunate. I picked a great career and have no regrets.